Hi, Miss Allen. My name's Dr. Sandy. Nice to meet you.
Nice to meet you.
How can I help you today?
Basically, I was wondering if you could refer me to a skin specialist.
Okay, why is that?
I've got acne. It's kind of flaring up, and I'd like to see someone.
Okay, all right. And tell me how long this has been going on for.
I mean, kind of my past 3 months. I mean, like about 3 months ago it started. I had it as a teenager, but I kind of used it. They gave me a cream, and it kind of went away. But I assumed I got rid of it. But obviously it's back again, and I need to get rid of it.
Okay. And did something happen 3 months ago for the acne to come and flare up?
No, I don't think so.
Okay.
Yeah.
And can you describe the spots to me? What do they look like for you?
I mean, it's like red. They're kind of red. I've got like red and like white heads as well,
Okay.
and they're really kind of unsightly.
Okay. Any scarring that you've noticed?
No scarring.
Okay. Bit of an odd question, but we just still need to ask it. Sometimes certain medications can cause acne, like steroids. Do you take any steroids at all?
No steroids.
All right. And I mean, how is the acne affecting you?
Basically, I mean, with the job I do, I can't afford to have acne because it's going to kind of cost me money, so I kind of need to get rid of it.
Okay. All right. And you mentioned job.
Yeah.
What job do you do?
I'm a model.
Okay.
So yeah, it's kind of, I mean, my face is my career. I mean, if I have bad skin, it's not going to get me the jobs, and I kind of need to do something about it before it gets any worse.
Okay. And you're saying not getting jobs. I mean, tell me a bit more about that.
I mean, yeah, it's kind of like, I mean, my colleagues are getting, jobs like galore, like left, right, and centre, and I feel like I'm kind of getting the leftovers because of it. So it's kind of, it's starting to affect me a little bit, and I'm kind of getting a bit, annoyed that I can't get rid of it, and I kind of want to find a remedy.
Yeah.
So if I can get a cream, if you can refer me, then that'd be great.
Of course. And you said in terms of getting a job, are you booked into any bookings for jobs for modelling?
I mean, yeah, my agent, he called me yesterday. Said I've been booked on a job.
Okay.
But I mean, at the moment, kind of a lot of the jobs are going stateside, so a lot of Americans are getting them. So it's kind of quiet for me.
Okay. Is that for you or for everyone else?
I mean, for everyone.
Okay.
So,
all right.
Yeah, but I feel like it's me more so now because it's quiet and because of this.
Okay. All right.
So, yeah.
Okay. And is it affecting you in any other way, like for example, relationships?
No. I mean, well, it doesn't affect my relationship. My girlfriend, she's a model as well.
Okay.
I mean, we've been together like 3 months. So I mean, I guess it's kind of, I'm a bit scared of, losing her to the fact that I have acne, which is silly, but I don't know, maybe it could have started because of the kind of stress of the relationship. I mean, she's a lovely person, she is, but I don't want to lose her for something I can maybe fix. So, yeah.
Have you spoken to her about it?
No.
No. Why not?
I don't know, she'd probably think it's weird.
Okay,
Yeah.
alright, okay. And do you smoke at all?
No, I don't.
No, or do you drink any alcohol at all?
Occasionally, maybe on the weekend, but yeah, very rarely.
Okay, and you mentioned that you used a cream before when you were a teenager. Do you remember what cream that was?
No, I can't remember the name of it. They gave me something and it just seemed to work, so I assumed it was that then.
Okay, alright. And sometimes skin conditions can affect your mood. Do you feel that, you're over low in your mood?
I mean, a little. Yeah, it's kind of up and down, I guess.
Okay. Does that ever affect, your appetite at all?
No, I don't think so.
What about sleep? Does it affect that?
No.
This is going to sound like a really odd question, but just have to ask it. Sometimes when people do feel a bit up and down and sometimes low, they feel like they want to sometimes take their own life. Do you ever feel like that?
No, not at all.
Okay, alright. And is there anything else worrying you based on your acne at all? Is it just the...
it's just the kind of, one, my job, and two, my relationship. It's kind of, I want to be able to get rid of it so I don't have to worry about it,
Yeah, of course. Okay. Is it alright if I examine your skin now, if that's okay? Right, so just looking at your skin, it does look like you do have acne.
Yeah.
I mean, do you know what acne is?
Spots, I guess.
Yeah. So basically, acne is like everybody has pores on their face, and acne is when the pores can get filled up with a bit of grease, oily grease, and sometimes they can also get filled up with natural bacteria that we have on our face, but they just go into the pores, they multiply, and that's what can cause that kind of those spots, especially the red ones that can happen. Is that quite clear in the explanation? Yeah. And there's 3 types of acne. There's mild, moderate, and severe. Okay,
so mine's severe. That's probably.
Actually, yours is quite mild.
Really?
Yeah.
I don't know. I mean, I would feel like it's severe.
Okay. Why do you feel like it's severe though?
I don't know. I mean, I just seem to. I mean, if it's come back, then I thought I'd gotten rid of it. Then maybe it's kind of something that's just going to continually come back.
Yeah.
I mean, that's why I want to. If you can refer me, then I can go get something a bit, strong.
Okay. In terms of getting something strong, what do you mean by that?
I mean, I've seen this. I think it's called Roaccutane.
Okay. Yeah.
And I mean, it's supposed to be like this wonder drug that completely, eradicates any kind of acne. I mean, from the results I've seen from people, I think that's definitely what I need.
Okay. Right. And do you know what Roaccutane does and how it works?
Just gets rid of them.
Okay, alright. Do you want to explain a bit more about that?
Yeah, if you can, please.
So Roaccutane is a medication that is only prescribed by specialists in hospital. And the reason that is because it is literally the last resort medication.
Okay.
And again, the reason why it's a last resort medication is because of the sheer side effects that it can give.
Good, okay.
Okay, so the side effects include things like headaches, nosebleeds, dry skin around the face and the lips. You can get depression as a result of it as well.
Oh, really?
And you can always get liver problems as well.
Okay.
Yeah. And that's why it's really used for severe acne.
Okay.
And as a result of those side effects, it also requires more rigorous monitoring as well. Okay. So you would be needing blood tests once every 2 months.
Okay.
And seeing a specialist just to monitor those side effects as well.
Yeah, I'm a big fan of needles.
Yeah, no, absolutely. But like I said, just to reassure you, your acne is actually quite mild. It's not severe.
Okay.
And like you said, you used those creams before.
Yeah.
And that really helped. I mean, one option we could do is we could use again a cream for your skin.
Okay.
And we can just see how things go. And see if things improve for yourself.
Okay.
How does that sound for you?
I mean, yeah. I mean, obviously the side effects you kind of listed, I don't really want to have side effects,
Absolutely.
So maybe we could try something like a cream.
Yeah. So this type of cream basically you apply once at night.
Okay.
And the reason why it's once at night is it's better to not have sun exposure and light exposure to this cream.
Okay.
And also it can cause a bit of skin irritation as well. So I think trying it once at night first is probably a good idea.
Yeah.
Something called benzoyl peroxide.
Okay.
And what we can do is try it once at night for 6 weeks, and then you can come and see me after 6 weeks. Okay. How would you feel about that?
Yeah. I mean, that sounds good.
Yeah. And other things you can do is just washing your face gently with warm water, not using any strong exfoliators is also really good.
Okay.
Yeah?
Yeah, that sounds good.
How about talking to your girlfriend?
Yeah, probably. I mean, I should kind of mention it. I guess it's a topic that I need to kind of bring up, but just so I'm a bit more comfortable, but yeah.
Okay, of course. Alright. And do you feel like you need any counselling in any respect?
No, I don't think so. Okay. I think I should be okay.
Alright, so let me see you in 6 weeks' time.
Yeah.
And if anything gets worse with your acne or any side effects with the actual cream, just come back and see me sooner.
Yeah.
Alright.
Yeah, sounds good. Thank you.
No problem.
Thanks.